So I'm an ER doctor and I got a story you're going to love. Several years ago, I'm working in an emergency department and I see an elderly gentleman who comes in with a simple complaint of a bite wound to his hand. Doc, I was just sitting there in my chair watching dinner and this mouse came up, climbed up my leg, bit me on the hand, and then ran away. I need to make sure I'm not going to get rabies. So I check out his hand and sure enough, he's got a little bite on his hand. And I reassure him, I tell him, sir, listen, you're not going to get rabies. Rabies doesn't really infect mice, but we'll clean up your wound. We'll give you a tetanus shot. We'll put you on some antibiotics, get you on your way. He says, that's great, Doc. I didn't even get a chance to eat my dinner. I'm ready to get home. So I turn around to walk out of the room, and I notice out of the corner of my eye, the monitor, his heart rate's a little bit fast. Normal is between 60 and 100, and he was about 110. So I tell the nurse, let's clean up his hand wound, watch him for about 15 minutes, and we'll let him go when his heart rate is below 100. Let me know if there's any problems. About 15 minutes later, she shows up and says, hey, Doc, his heart rate's still about 110, and now his blood pressure's cycling a little low. It's about 90 systolic. I tell the nurse, well, as a precaution, let's put an IV in, give him a little bit of fluids, we'll run some blood work, check a urine test, make sure there's no infection or anything weird. I'm waiting for the test results when about a half an hour later, the nurse says, hey, Doc, can you please come in the room? His blood pressure's bottoming out. I look up at the monitor, I'm like, oh my gosh, his blood pressure is now 60 systolic. He is sick. So I'm having the nurse squeeze in the fluids. And I tell him, sir, I'm going to have to put in a central line. A big IV that goes up in here in your neck and goes into your internal jugular vein. This allows me to give you pressor medication that will constrict your blood vessels and artificially bring your blood pressure up so you don't die. His blood work's starting to come back. And his white blood cell count, which measures inflammation, some doctors will say infection, is extremely high. Fortunately, he's responding to the pressor medications we're starting, and now his blood pressure is starting to come back up closer to an acceptable range. His urine is cloudy like milk. It is obviously very infected. We get him stabilized, his blood pressure is stable, he's got antibiotics in treating the infection, and I admit him up to the ICU. He shows up to the ER about a week later, but not as a patient. He showed up to tell me something very important. I actually set up a trap and I captured the mouse. So he pulls up a little hand carrier and sure enough inside he has a little mouse. I said, why did you capture the mouse? He said, Doc, I had no idea I was sick. And out of nowhere, a mouse came out that I'd never seen before and bit me on the hand. I have to believe that was a message to get me to the hospital. And truth be known, if he had not come into the hospital, he wouldn't have survived. And he tells me, I'm going to keep it as a pet and treat it as a service mouse. I didn't really think it was the time to tell him that when there's one mouse, there's likely many mice, but I'm sure that's something he'll figure out on his own.